I feel very privileged to be able to speak on behalf of thousands and thousands of patients, both in the public and private sector, around the topic of access to affordable medication. My story started in 2008 when I was diagnosed with breast cancer, and I underwent a mastectomy. And in 2012, through a routine blood test, it was discovered that I had a second cancer called multiple myeloma. I'd never heard of multiple myeloma, but I understand it is linked to the leukemia type of cancers. It's a cancer of the bone marrow, so it's a blood cancer. And I am under the care of the Constantiaberg Hematology Unit with Dr. DuToit, who is an amazing man. And in 2012, from originally being asymptomatic with the myeloma, it was very low grade, my myeloma became active. And I was placed on a drug called thalidomide. And I was on that drug for about 2 to 3 months, and I developed a peripheral neuropathy of my feet, which means the nerves are damaged in my feet. And it's a very painful thing that I still have today. And so my doctor, and I think the DG and also Professor Paul Ruff have I've realized I'm one of the 5 patients that was put forward by Dr. DuToit requesting access to a drug that I urgently needed. Originally, Dr. DuToit applied to the MCC for a Section 21 for me to access lenalidomide via India, and we were successful. I was given a 6-month approval, and my medication was imported from India through the Constantiaberg importation process, and I was able to collect my medication at the pharmacy. And my myeloma numbers started to go down. It was, I was really beginning to feel well again. And then I applied for a second approval once my first one had expired. And Dr. DuToit said to me that there was a company in the US, Celogene, who had requested approval for lenalidomide, and the drug was called Revlimid. And he said to me he didn't know how long when the approval would happen with Revlimid, if it would, but as soon as that happened, then to import would be stopped. I think it was 2016, Celogene had approval to register the drug lenalidomide under the name Revlimid in South Africa. On that day, when that approval went through, somebody somewhere in South Africa a document, an approval document registering Revlimid. When they did that, my right to healthcare, to access a generic that was working, was taken away from me. And it was taken away from every other patient that had managed to have a Section 21 approval. And I don't know who did that. And I don't know why. Because what I found out is the drug that had been approved in South Africa, and I want to show you this, the drug Revlimid. This is the drug. 75,000 rand. 3,000 a day. That's what South Africa approved. This is what I was getting from India, the generic, the very same thing. And the cost at the pharmacy in India is 1,900 rand. With importation costs, I was paying about 4,500. But my family were helping me with the payments. So, whoever signed that document went from 1,900 75,000. And whoever did that eliminated all the patients that were originally accessing this drug. And I have to ask why. To me as a patient, this does not make sense. It is morally reprehensible, and I don't care if it's legal. The law needs to be changed, and the needs to be changed. Today, my myeloma is very active again. I was fortunate, I'm sorry, but even there, because Revlimid cost 75,000, they could only approve 4 boxes a year. I need 12. So it still didn't help me that I had a generous medical aid. And I'm angry that our medical aids have to pay this amount of money, 75,000, when in fact they can pay 1,900. Because you know what? If they're paying 75,000 for this, everybody that's on medical aid, your costs are going to go up. It doesn't just affect me. It affects also in the public sector. What chance has a go-go got of going to a clinic and accessing these drugs? They've got no chance. And that is wrong. Our Constitution says we should have access to healthcare. And for me, for an organization to approve 75,000 versus this, I'm sorry, it's wrong. So, yes, today I'm back on. I'm on chemo tomorrow. I've had radiation on my bones because the myeloma affects your bones, and I'm on 16 chemo treatments. But you know what? I think for me that if I can use my voice, even though I'm going through this, it's an incurable disease. But if I can access this medicine, then I can live a few more years, and I can be a voice for all of those that cannot access generic medication. And I just want to say thank you. Thank you for having these groups. Thank you for everybody that is involved in trying to change something that I think the DG said is a fractured system. There is a will here to put it right. And I want to be part of that. That it's put right, not just for me, but for every South African and everybody that in the future may be a cancer victim. Okay, that's all from me.